Good morning, Facebook. Good morning. It's Saturday morning, and I'm Cook County Commissioner Donna Miller here with you this morning. We are live, and we are going to just wait a minute or two so our audience can build. But thank you for joining us this morning for a very important conversation on CPR training. And we are in Heart Month, which is the month of February. So we're always wanting to make sure everyone is focused and educated on what they can do to help save someone's life. And that's why we're here today. So just give us a minute or two. We just went live and we want to give the audience a chance to build. I will be quiet for just about 1 minute while we wait for the audience to join us. So thank you for being here. Good morning, everyone. We are on Facebook Live. We are waiting for the audience to build just about another moment, another minute here. And we will get into our very important conversation this morning on CPR training. And guess what else we will learn? We will learn what CPR actually stands for. I know we all know, we've heard CPR before, but do you know what it actually stands for? But we will find that out in just a minute. And we're going to give the audience a chance to build while we're here on Facebook Live, and we will get started in just about 1 minute. Good morning. We want to thank everyone for joining us this morning. I'm Cook County Commissioner Donna Miller, and we're here this morning during American Heart Month to focus on what we can do to help save someone's life. And we are so fortunate to have some excellent instructors with us this morning, and we will get into our presentation now. I'm Cook County Commissioner Donna Miller, and during the month of American Heart Month, we focus at Cook County on cardiovascular disease, and more importantly, right now, we are focused on CPR training. That's what brought us here this morning. We're fortunate to have some instructors with us from Illinois Heart Rescue to focus on CPR training. But before we get into that, I just wanted to mention a couple of things. For the past 3 years, this is the 4th year I've introduced a resolution at Cook County that focuses on the importance of CPR training. The reason for that is very specifically because the leading causes of death in Cook County, 25% are heart disease, followed by cancer at 24%. So unfortunately, these are very high numbers, but they also mimic the high numbers that we see across our entire country. The other unfortunate part about heart disease, it's especially high for African American and people of color in certain communities. Those mortality rates have gone exceedingly high, especially during COVID. And we see the incidence of heart disease as a comorbidity for COVID-19. So what's that going to mean? That's also going to mean that we're going to continue to see high incidences of heart disease along with COVID, because unfortunately, COVID is not going to leave us. It'll be something we have to learn to live with, but we need to learn to live with it with tools in place that we can implement to help save someone's life if that occasion occurs in our presence. That also lets me want to talk briefly about why we should know CPR training. And that's why we're focused on this month at Cook County. I did institute a virtual CPR training contest this month at Cook County so that Cook County employees will be trained, and we have the help of our wonderful training department. Also, last year, we were fortunate enough to put CPR virtual training in the initial employee training as a new hire at Cook County. So we're encouraging all Cook County employees to be CPR trained. And why is that important? You're going to find out why in just a few minutes. But one thing I also wanted to mention about CPR training is the bystander effect. And I think that they can get into that a little bit more when they're talking about that. But what is a bystander? We are the bystanders, people who are there to witness a cardiac event. So when you are a bystander, you have to jump into action. And that's why this CPR training is so valuable and so important. So you know what to do in the event of a cardiac event where you see someone who's in distress, you can start to administer CPR. And the second thing is someone should call 911. Unfortunately, the other thing in African-American communities and communities of color is the lack of training for people to understand or know CPR training. So people in these communities have less chance of survival because of the bystander effect. So we'll get into more of that later, but I wanted to encourage you all, if you have not ever learned CPR, take this time right now to learn this vital CPR training on the virtual platform. And they can also explain other avenues that you can go if you wanted to have more in-depth training, or if you want to get someone in your household trained, your workplace trained, your school, your park district, any area that is important where people are. Where people are is where one of these events could happen. So thank you so much for being here today, Illinois Heart Rescue. If you could just take a moment to introduce yourselves, talk a little bit about what you're going to be focused on, and we appreciate your diligence, your expertise, and what you're willing to share with us today.
Thank you. Thank you so much, Commissioner Miller. Thank you very much for inviting us. My name is Terry Campbell. I am currently the Executive Director of Illinois Heart Rescue. Clinically, I am also a flight nurse at the University of Chicago. And I'd like Claire to also introduce herself.
My name's Claire. I'm the community coordinator at Illinois Heart Rescue. I've been an EMT for about 5 years, and I also go to school for public health right now.
So as Commissioner Miller had mentioned, cardiac arrest, cardiac disease is a crushing health burden in the United States as well as in the city of Chicago. And first of all, I'd like to welcome you to my home. And one of the reasons that we chose to do our bystander CPR training here is 75% of all cardiac arrests happen in the home. So this is a very important reason on why everybody should learn at a minimum how to do bystander CPR, because the chances are unfortunately good that if you're going to need to perform CPR, it's most likely going to be on somebody that you know and you love. So before we begin, I just would like to also echo some of Commissioner Miller's comments. Cardiac disease shows no prejudice. It can happen to babies. It can happen to children. It can happen to adults. It can happen to the elderly. Sudden cardiac arrest is different than a heart attack. So sudden cardiac arrest, think of your heart as two different parts. The first part is the mechanical part, the part that pumps blood around the body. The other part is the electrical part. Think of it as a spark plug for your car that's making your car work. With a sudden cardiac arrest, the electrical part of the heart suddenly stops. And then the heart stops. The medical word arrest, cardiac arrest. Cardiac means heart, arrest means stop. So when that electrical signal stops telling the mechanical part, the pumping part to work, the heart suddenly stops. And again, that can happen to anybody. Now that's different than a heart attack. A heart attack, the heart is a muscle just like any other muscle, and there are large blood vessels that are feeding the heart. So if my fist is the heart and my fingers are the blood vessels, There's big blood vessels that are feeding the heart. If there is any blockage or any narrowing of those large blood vessels, then the actual muscle of the heart, particularly in that area, can die. So not all heart attacks cause cardiac arrest, cause the heart to stop. But if there's any large blockage to those blood vessels, then that section or that portion of the heart can die. So regardless, it is always important to know bystander CPR, and if you have the bandwidth or the resources to actually get CPR certified. So why is that? If a victim has a cardiac arrest and that heart is not beating, if nobody intervenes, nobody does bystander CPR, the chance of that patient or that victim surviving is 0 within 10 minutes. So the faster we can jump on, the faster that we can participate with some bystander CPR, we can literally double to triple their chances of survival. So think, this could be your child, this could be your spouse, this could be somebody that you love and is very important to you, and you get to be the hero that helps to make sure that they're neurologically intact. Now, many times I'm speaking to lay people, non-healthcare professionals, and they say, well, you know, I'm scared. What if I do it wrong? Or what if I make it worse? Well, let me speak very plainly as a nurse. You cannot make dead worse. And right now, when their heart is not beating, they are in this suspended state of death. And we can either turn that hand back and make them alive, or if we do nothing, then they're going to be permanently dead. And none of us really want to be permanently dead, for sure. So again, the very simple steps of bystander CPR can double to triple those chances of survival. So let's start out. How are we going to even know if somebody needs to do bystander CPR? So again, people were talking or asking me saying, well, what if I do it wrong and what if I mess it up? Here's the great thing. You can only make things better. If, heaven forbid, you do CPR on somebody and they were just really soundly asleep, I promise you, the first time you hop on their chest and you do a compression, they're going to wake up and they're going to push you off. So you don't have to worry about that. If somebody is diabetic and maybe they've got they're in a diabetic coma or something related to their blood sugar, same thing. If somebody is putting all of their weight on your chest, that's a painful kind of thing if you're awake and alert, and people are going to wake up and they're going to push you off. So you don't have to worry about that. Can you seriously hurt somebody by doing CPR? What if they don't need it? Again, you cannot. The heart has its own native pacemaker, its own native rhythm. Even if I do CPR on Claire, she's going to be mad at me and she's going to push me up, but I don't have the ability to disrupt her normal heart cadence, her normal heart rhythm. So that's the good thing. The worst thing that we see from CPR is occasionally a patient can get a bruised rib or maybe a broken rib. But gosh, think about it. People survive broken bones all the time. They do not survive without having an intact heart and an intact brain, right? Okay, so let's start out talking about how are we going to even know if we need to do CPR. So first things first, if somebody is on the couch and they're slumped over, if they're on the bed and they're not responding, we want to make sure that they're okay. So the first thing that we're going to do is we're going to shake them and we're going to say, hey, are you okay? Now, what happens if we're on the L platform and somebody's down on the ground and we don't want to shake them? You know, we're a little bit nervous. Remember, you don't have to use your hands. You can use your foot and you can kind of tap them on the bottom of their foot and say, hey, are you okay? Are you okay? In medical words, we call that checking for level of consciousness. Are they responding to their environment? So if I touch them or I talk to them or I shout at them and they're not responding to their name, that's concerning. We should be responding to our name. The next thing that we're assessing for is, Are they breathing? And oftentimes lay people say, well, gosh, how am I going to know? How, I don't have a mirror. I don't want to hold it up to their face. How am I going to know? So unfortunately, if somebody is not breathing, they turn a very ugly color of purple or blue within a pretty quick period of time. What can be more confusing is sometimes when people have that sudden cardiac arrest where the electrical part of the heart is not working, the brain is still very much trying to keep the body alive. So the part of your brain that tells the body to breathe says, okay, I know the heart's not beating right now, but you keep breathing. You keep doing you. But it's kind of an irregular breathing pattern. We describe it as a fish out of water, kind of a gasping breathing, very noisy. Or it might honestly sound like a zombie kind of moaning, or kind of a snoring respiration. Now, some of us have spouses, myself included, that my spouse likes to snore in the middle of the night. But what do? We give them a sharp elbow, we have them roll over, and they stop snoring, right? If I'm touching somebody, if I'm shaking them, I'm asking them if they're okay, and they're continuing to have that snoring respirations, that's a problem. So that's how we're going to know. If somebody's not responding to their name, they're not responding to touch, they're not breathing or not breathing normally, we want to call 911. Okay, why do we want to call 911? First of all, they're the healthcare professionals. Average response times in the United States are about 5 to 7 minutes. That may be different depending on the neighborhood that you live in, depending on the amount of construction, depending on the time of day. So again, we can't count on 911 providers getting there to save our loved ones' lives, because for every minute that somebody has a cardiac arrest and no CPR is performed, the chance of survival decreases by 10%. So that is what I meant by, if we don't do CPR within 10 minutes, our loved ones have a 0% chance of living. So we're going to call 911. I also say, as a healthcare professional, who doesn't want a very handsome fire person or EMS person there to help you out, right? I would like to tell you that we all look like we work at that TV show Chicago Fire. That's maybe not the case for everybody, but they still know how to do CPR really well. So we determined that we need CPR. We determined that we need to call 911. Now, if you are in a public place, it's very, very important that you're very specific with who you are asking to call 911. So what I would do is I'd say, hey, you in the blue Illinois Heart Rescue t-shirt, you call 911. And, you over there in the white t-shirt, you go get me an AED. We'll talk more about an AED coming up. I will tell you, as a flight nurse, because that is my clinical job, is oftentimes I am on scene and people have their phones out, but they're not calling 911, they're videotaping. So that's an unfortunate part of our world. So make sure that you're very specific when you're giving your directions. If you give somebody ownership to make these calls, they're going to do it. Okay, so now let's jump into the details of how we're going to teach somebody how to save a life. Now, this is different than the American Heart Association's education. I am also an AHA instructor, but what we're going to be teaching you is bystander CPR. That means we're not going to be doing any ventilations or any breathing. And you might think to yourself, well, gosh, these are my loved ones. I want to save them. Here's the good news. If you do good, high quality compressions, you don't need to breathe for them for about 10 minutes. And by then, EMS providers will be there and they will take over that part of the ventilation. Your blood holds oxygen. And so by doing those good compressions, we're still able to move that oxygen around the body. So the first thing that we're going to do is Claire is going to show you proper position. So she's right next to our mannequin. And you can see where Claire is kneeling right next to the mannequin. The reason that she's doing that is she wants to be able to use the weight of her body when she's compressing. So Claire is going to put one hand out in front of the other. Her elbows are straight and locked. and the heel of her hand is going to go on the center of the chest. So let me hold up my very handsome gentleman here. So you can see right between the nipple lines on this bone that is right in between the breast. So the medical word for that bone is called the sternum. Commonly, people call it the breastbone because that's where that bone is located. If you kind of tap on your own chest, you can feel it. So her hands are going to be directly on top of each other. The heel of her hand is on the center of that bone, and her shoulders are directly over the patient. So her shoulders are directly over her hands. Now, this way she can use her body weight when she's compressing the chest, because it's not easy to compress a chest. The ribs are intended to keep the chest expanded. Now, Claire, I'm going to turn you sideways again, and we're going to show them bad positioning. So if Claire is, come back further. If Claire is way far back like this and she's trying to push now she's only relying on the strength of her hands, and her hands are not going to be as strong. So Claire is going to come up directly over and able to use her body weight to compress. Okay, so the next question is, how far do we compress? Now, the American Heart Association will say for an adult, we push about 2 inches. Unfortunately, even as healthcare professionals, that's almost impossible for us to objectively measure. Our goal is to push the chest from the top to the bottom by about 1/3. But that's also really hard to kind of quantify when you're the person who's doing compressions. So what I advocate is that you try to push them in half, because the reality is with an adult chest, because of that strong rib cage, it's impossible for us to push them in half, but it mentally reminds us that we need to push hard. Now, if we want to translate this to doing CPR to other people, a baby, a child, an elderly person, again, if you think about the depth of their chest and you're just trying to push them in half, that's a little bit easier than trying to quantify, is this a 1/2 inch, 1 inch, 2 inches, whatever the case may be. Okay? Now, when you're pushing down, you're ejecting blood out of the heart. So some of that blood is going around and around to the organs. But most importantly, what you're perfusing is the brain. You're sending blood up to the brain, and you're like, brain, you are super important. We want to make sure that you are neurologically intact at the end of our awesome CPR. When you come off the chest, and Claire is going to demonstrate this, when you push down, remember, you're trying to push them in half. When Claire comes off the chest, she's literally coming all the way off her chest. What happens then is that the heart fills back up with blood, and those great big blood vessels that are keeping the heart alive, they're also going to be filling up with blood. So that way we keep the heart muscle alive as well. So really, when you're doing your CPR, when you're compressing, you're keeping the brain alive. When you come off the chest, you're keeping the heart alive. And a nice benefit, we're also sending some blood around to those other vital organs. All right, so we know how to recognize somebody needs CPR. We know how to call 911. We know how to position ourselves next to the victim. We know how to straighten our arms, use the heel of our hand. We know that we need to push them in half, and we know we need to come off the chest completely. Now, how fast do I do it? So the cadence or the rate is 100 to 120 times per minute. How in the heckity heck are we going to remember that when we're on the L platform at Belmont, right? So what we teach people is to sing a song in your head that's 100 to 120 beats per minute. That may be your favorite gospel song. That may be Black Eyed Peas, Let's Get It On. It could be Staying Alive from the Bee Gees. But think about what is your favorite song that's 100 to 120 beats per minute. I apologize to the Sox fan. I'm a Cubs fan. It could be Go Cubs Go. Again, think of any song that's a favorite song for you, and that is the cadence that you're going to use. As healthcare professionals, we use a metronome, something that clicks and keeps us on the beat. Because again, when you're excited and scared, you might be doing it too fast. And as you fatigue, you might be doing it too slowly. Okay? All right. How long are you going to do CPR? Well, you're going to continue doing continuous compressions until that really good looking EMS person shows up. Okay? And very competent person. Now, I will tell you, and often when I'm teaching CPR, I tell people, if you're not fatigued after doing CPR for 2 minutes, you're doing it wrong, because it's hard, right? You're pushing down hard on that chest, you're coming back up. So if there are other people in your vicinity, you can recruit them to help you do CPR. Now, I might say, hey, Claire, I need you to do CPR. I'm getting tired. And Claire's going to be like, I don't know how to do CPR. I don't want to do CPR. Doesn't matter. You're going to be tired. We both love this person. Kneel down, Claire. I'm going to show you how to do this. And then each of you can take turns. We try not to let somebody compress or push more than 2 minutes. Your brain and your enthusiasm and your spirit might say, I'm strong. I can keep doing it. But when we look at the research of the quality of people doing CPR, we see that the quality really drops off after about 2 minutes. I have to tell you, I'm not physically a really big person. If I'm doing CPR on an adult male, somebody that has a very big chest, I actually need to swap off sooner, about every minute or so, just because I don't have the same physical strength. Okay, so what we're going to do is I'm going to have Claire give us a demonstration from the beginning. She comes across this person. She wants to see if they're okay. And then she's going to demonstrate how to do the CPR. And then we're going to talk about the automatic external defibrillator. I'm sorry, Commissioner Miller had kind of teed me up on this and I forgot. What does CPR stand for? CPR stands for cardiopulmonary resuscitation. So that's a lot of Latin in there. Cardio means heart, pulmonary means the lungs, resuscitation means restart, get those both working. So when somebody has that sudden cardiac arrest, their heart's not beating, and as a result, they're not breathing. And so we need to restart all of those things. Okay, so Claire, why don't you take it from the beginning of coming across this poor naked guy in my living room floor.
Okay. Sir, are you okay? So he's not responsive. So from there, I'm going to check breathing. He's not breathing. So from there, I'm going to say, I'll call 911. You go look for an AED. I'm going to put 911 on speakerphone, and they're going to walk me through CPR. Hands on the chest, arms locked.
Staying alive, staying alive. I know everybody's wishing that I would stop singing. I don't blame you. Okay, terrific. So you could see Claire was really using her body weight to compress the mannequin and to come all the way off the chest. So Claire brought up something that is super important. I'm glad she reminded me. When you're calling 911 call takers, they're going to ask you questions. What's your name? Where are you? What is your location? And again, you might be someplace and you don't know where you are because you're in the middle of a bunch of buildings. They've got ways to figure out where you are. But most importantly, 911 call takers are all trained in coaching you how to do CPR. So you don't want to be in a panic and hang up the phone with them. You want to stay on the phone with them, and they're going to be your cheerleaders. They're going to help to remind you. So gosh, I don't know if any of you ever took a foreign language when you were in school. If you don't use it, you lose it, right? So when you were in school, you might have known all those words. CPR is kind of the same way. That's why Claire and I really like teaching bystander CPR, because it's very simple, right? The first thing, recognize a problem. Second thing, call 911. Third thing, hop on the chest, push hard and fast. And then the last thing is using an automatic external defibrillator. That's the real name for an AED. So remember, as I was talking earlier, that the heart has a mechanical part of the heart and an electrical part of the heart. So when the heart has that sudden cardiac arrest, instead of pumping, it might be kind of quivering on a plate like it's jello. So there are certain cardiac rhythms that as healthcare professionals we look for. And then we know if we use an AED, it sends a medical grade of electricity through the skin to the heart, and it resets that pacemaker. Or again, if we're using a car analogy, it kind of is like a new set of spark plugs that it makes everything work well. Here's the great thing about an AED. Excuse me. AEDs are way smarter than we are. In fact, I'm going to tell you, they're smarter than healthcare professionals. Their ability to recognize cardiac rhythms that need electricity is almost 100% perfect. I cannot tell you that as a healthcare professionals that human beings are 100% perfect with their interpretations of cardiac rhythms. So these are awesome. Where are we going to find them? Well, they're in public locations, and some places are mandated to have them. For example, any health club, park district, gym, they're mandated by state to have them. Other places are transportation centers. So if you're ever at Midway or at O'Hare, they're about every 100 feet. They're commonly in a white box, and the bag for the AED is red. It has a heart on it and a lightning bolt through it. So that is what an AED is. So again, different public buildings will have them, but not all. If you're in a home, and 75% of the time people are, most of us don't own an AED. So again, that's why it's very important that you're calling 911, because they will come with their own version of an AED so they can restart the heart. So how does an AED work? Well, it's actually designed for people that are not even English speaking or can't read. So they really make it very simple. You're going to turn the green light on, and we're going to let you hear it in a minute, but it's going to send you through voice prompts. The first thing that it's going to tell you to do, it's going to tell you to remove the patient's clothing. The reason that we're doing that is these pads need to go on bare skin so it can pick up the electrical impulses. Now, let's be real. We're in your living room, and this is your grandma, and gosh, none of us want to see grandma without her clothes on, right? That's okay. Remember, you can just unbutton the shirt or open the shirt, and then you can put these sticky pads on, but the pads have to be on skin. Now, where do the pads go? So I'm going to show you here. The pads actually have a picture, and they show you where to place the pads on both an adult and on a child. So you're going to push those firmly on the skin, and then the AED is going to get a little salty. It's going to yell at you. It's going to say, do not touch the patient. And you're going to be like, okay, I'm not touching. The reason that you're not touching the patient is not that you're going to get shocked, because you have to be wearing these pads in order to get shocked. The reason you're not touching the victim is because these machines are so smart that if I am touching this victim, grandma, the machine's going to pick up my pulse, because my heartbeat is quite fast because I'm concerned about my grandma, right? So that's why we're not touching it. We're allowing the monitor to interpret the cardiac rhythm. Then the machine is going to tell you one of two things. It is either going to say shock indicated, and that means we're going to continue to not touch our grandma, and this red light is going to flash, and then you push the button. So again, you don't have to worry about getting accidentally shocked. It's not going to happen. You're going to be awesome. You're going to be a hero. You're going to save a life. Now, the other prompt may be no shock indicated, because again, the machine is so smart, saying, hey, electricity is not going to help in this situation, but the machine is going to tell you resume CPR, and it's got a metronome in it, so you can hear it going click, 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 and it's going to tell you to do those compressions. Okay, so let's turn this on. I'm going to have Claire demonstrate this.
Adult patient. If the patient is a child,
Ours is
press
a
the child
trainer.
button. Remove clothing from the patient's chest. Press pads firmly on skin.
And she's doing it
Apply
just
breast
as the
pads firmly
pictures
on
show.
skin. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button.
See how it's flashing here? So I get to control it.
Button. Shock delivered. Begin CPR.
Can you hear it? It's giving that little click. Okay, I'm going to turn it off. Okay, so let's talk about this. I just told you that the AED restarts the spark plug. It starts the heart. So why do I need to do CPR? Here's why. Remember the mechanical part and the electrical part. The electrical part may be fixed by the AED, but the mechanical part takes a little bit to get restarted. So have you ever needed to do a hard restart on your phone or your computer? So you do that hard shutdown, and then it takes, you fix the electrical part, but it takes a little bit for that line across to go across the screen before your computer will boot back up or your phone will boot back up. So again, don't worry about doing CPR if you fixed them, because you can't hurt them. So when are we going to know to stop CPR? We're going to know. Wouldn't it be great if they sit up and shake our hand and give us a smoocheroo on the lips and say, thanks for saving my life? Well, maybe. I guess it depends on who our victim is, right? Either that, or if they're showing signs of life. So if somebody starts to cough, or they're kind of pushing you away, that would be signs of life. So we no longer teach lay people to check for a pulse. I'm going to let you in on an unfortunate secret. Healthcare professionals don't always do a great job with that. Sometimes we can miss a pulse up to 56% of the time. So again, if you've got a sick heart and it's not effectively beating, it might be just kind of barely beating, it might be hard to pick up that pulse. So we go more on signs of life. Okay? How are we doing on time? Hopefully we're answering all your questions. Okay, so let's review. Okay, with bystander CPR, no offense, AHA, you don't need a 2-hour class. What I'd like to really encourage everybody on this call is please contact us at our website, www.illinoisheartrescue.com. So that's one word, illinoisheartrescue.com. I'll ask Commissioner Miller to also put this on her website for you. Claire is really looking for more work. And we teach, we come to you, we'll come to your church, we'll come to your school, we'll come to your place of business, or we can do it virtually like this. And we will teach your entire community bystander CPR. Are you ready for this? Drum roll. For the big price of $0. We are a nonprofit. This is very much part of our mission. This doubles to triple survival. We want to help make your community more safe. So please, let us help you out. I need to keep this girl busy. So please help us. Again, just to review, what are the very simple steps? Recognize a problem. Call 911. Push hard and fast in the center of the chest until help arrives. Use an AED if one's available. And remember, all you have to do is turn it on. The machine is going to tell you what to do. You cannot do it wrong, and you cannot hurt yourself. Are there any questions or anything we can answer?
Terry and Claire, thank you so much for that excellent, excellent demonstration. And I love the fact that you are showing it from home to make everyone comfortable in exactly what you said. So we appreciate that. I'm just going to open it up for any questions that may be in the chat. So I'll let people post any questions if they happen to have them. But one thing I just wanted to reiterate or have you reiterate is the fact that you really can't hurt someone. If you could just say that again, and then also go over one more time, because I think that bystander effect numbers are so important. And after this, I want to post those in the chat, because if people think who might be listening, or they might know CPR, but how could they help to be the people to not train, or to get other people to get trained because of those bystander numbers?
Yeah, absolutely. So doing CPR cannot seriously hurt anybody. The heart has, let's say I've got somebody that maybe is my college student and went out and had a few too many beers last night, right? And I'm just having trouble waking him up. And I think, oh my gosh, I have to do CPR on him. He's not responding to his name. He's kind of snoring. And so I do CPR on him. His heart has a native or a natural pacemaker that keeps the heart beating at a normal rhythm. If I go on and I do compressions, it's like, you know, those of us that are older that used to play vinyl records, you can't skip that record, right? It's impossible. The heart is smarter than we are. And believe me, Nate would not be too happy to have his mom pushing on his chest. He would be like, okay, Mom, I get it. I'll get up and clean the bathroom now, right? So that's the first thing. The second thing, the most common injury that we have as a result of CPR is somebody might get a bruised rib, or they might get a broken rib. Broken ribs, nothing. We're not talking about wearing a cast or any special binder. It might be a little bit uncomfortable, but that's terrific. They're alive to let you know, hey, you bruised my rib. Okay, so that's a really good thing. How about if Claire and I demonstrate? Claire's doing CPR and she's going to teach me how to do it. So we're going to just turn our mannequin sideways here. Okay. Oh yeah, I forgot about that. Also, if you guys want to practice at home, I made my husband give me one of his undershirts today, and I just drew eyes and a belly button on here. And then all you have to do is put this over a pillow. And here you go. You got your own little CPR mannequin. So you can practice doing those compressions with your hands right in the middle of the chest, right between the nipple line there. Okay, so should we do it with the pillow? Yeah. Okay, good.
So if I learned it at school or online or something, or on this Facebook Live, I would go home and I'd say, here, well, I learned this. We can use this pillow to practice. The three important things are recognizing, responding, and then calling 911. So I would say you'd have to check responsiveness, and I'd check breathing, and then I would call 911. And then to do compressions, you put your hands in the center of the chest, lock your elbows, lean over, and do compressions like this. And then I could show them the rate and the responsiveness. I could go online, show them a video, and if you can go home and show 5 people, then that would make a big difference. They can show 5 people, and it can kind of transfer up from there.
On our website at illinoisheartrescue.com, we have an entire section dedicated to learning bystander CPR in 5 minutes. We have some really fun and funny videos on there. So we want you to come on our website and practice.
Yep, that's great. We're going to put the website in the chat. And we've heard a couple of comments, and everyone wants to thank you for doing such a wonderful job. And they have no questions, so that is also great. And I want to thank you as well. And I do want to reiterate one other point that you mentioned about the AEDs. It was great to see it because I know people walk by it all the time, or maybe they don't even know they're walking by one at their office. When I literally started working at the county, the AED was right outside my office door. And I asked the people on my floor, I'm like, hey, did you guys know there's an AED here? They're like, no, where? So it's great for people to recognize where the AEDs are located if they work in an office, if they work in a school, or even if they're just in a building one day that they know they go to a lot. If you're shopping somewhere, where are those AEDs in case someone, maybe it's not you, but someone asks you, where is it? So I'm glad that you pointed that out and showed how to actually use it and hear the voice, because I think that also scares people. Like, okay, should I take it down and use it? Should I not use it? What if I break it? Or even things like that. They're afraid of the machine. So
Commissioner Miller, can I just interrupt because you brought
yeah.
up something great. Some of the older cabinets that the AEDs are on, that they're housed in, they have a sticker that says for healthcare professionals only. When the AEDs were first designed in the 90s, the legislation at that time was only intended for doctors, nurses, paramedics. That legislation has changed for well over a century, and it is intended for public use. But those cabinets can be expensive, so businesses or health clubs, they might not have replaced the cabinet. So please know, this is intended for lay people, and we need action. And remember, you can't use it wrong. You can't use it incorrectly.
That's another great point. Well, you are such an excellent instructor. Both you and Claire did a great demonstration. I love the t-shirt idea too. And I just wanted to ask, is it true? I think that in Chicago, CPS schools, do they get CPR training students? Do they have to get that before graduation now?
So in the state of Illinois in 2014, there was legislation passed called Lauren's Law, and it requires every high school student in the state of Illinois to have the ability to learn bystander CPR. As everybody most people on this Facebook Live probably are aware, unfunded mandates are hard to implement. So that meant the state of Illinois passed this mandate, but they did not have mannequins for the schools. They didn't have a way to teach the schools. So Illinois Heart Rescue, we used our own grant funds, and we purchased CPR training supplies for every high school in the state of Illinois through the Illinois State Board of Education. So it's through the regional offices of education. So if anybody is on their call and their high school is unaware, they need to contact the superintendent of their school district, and they can help them locate those CPR training supplies. We also created those videos. So again, we have a 4.5-minute video called Artie the Heart that the high schoolers love, right? It's fun, it's infotainment, I believe is what we call it these days.
Well, thank you for that. And I think that you guys were instrumental in helping me get Southland Prep High School trained a couple of years ago, all the teachers as well as students. And yeah, everyone pay attention to that. We want our next generation to be all CPR trained, so they won't have to worry about that if in case they do run into someone, because the chances of them running into someone are going to increase, unfortunately, because of COVID and because the numbers keep going higher. But we can help save someone's life just by knowing these basic skills that seem basic, but are so important. So I just wanted to also ask you one more thing, because I was fortunate enough a couple of years ago to go to the American Heart Association Go Red for Dresses fashion show. And Susan Lucci was one of the speakers there. And she gave such an impactful story about how she did not recognize initially the signs of a heart attack. And because she ignored it, but then she was around someone who said, it sounds like what you're describing is a heart attack, went to the doctor and had to have valves unclogged that she had no idea. And she's very healthy. She exercises, on and on. So if you could just remind us, I know we're focused on CPR, but because it's Heart Month as well, if you could just remind us, what should we, if someone is experiencing some sort of cardiac symptoms, what should they be paying close attention to, especially women, because we know it's the leading cause of death for women?
Yes. So for people for cardiovascular risks, there are some variables we can change and some we can't. So we can't change our gender easily. We can't change our race. So there can be some genetic influences that may increase your risk of cardiovascular disease. In fact, as a nurse and as physicians, one of the first questions we ask is, do you have a family history of heart disease? Did you lose somebody in your family at a young age of heart disease? Because those are risks that we want to pay attention to. Other risks that we can modify: our diet, our exercise, our stress levels. And as Commissioner Miller has pointed out, COVID has very sincere contributions to poor cardiac outcomes. So, and the disparity in the United States is huge. So again, if you're a person of color, you're at higher risk than a person that is Caucasian. It is one of the core tenets that Illinois Heart Rescue is based on, is leveling that disparity and that inequity. But let's talk about some of those warning signs. Classic warning signs of cardiac involvement would be somebody has either pain in their chest. Often they describe it as a pressure. They feel like an elephant is sitting on their chest. Hard for them to take a deep breath. They feel sweaty. They might have pain in their jaw or pain in their arm. Those are classic cardiac signs, unless your last name is female. And women tend to present with more vague symptoms that are harder to assess. So they may feel very hot, they may feel hot and sweaty, or they may feel very cold. They may be, their only symptom is they're just so fatigued, they're just so tired. Or they complain of indigestion or kind of heartburn. Now, if you think about it, I'm female. There's plenty of times that I'm freezing cold, or I'm hot, or my tummy's upset, or I feel really tired. Women, sorry men, I'm not dissing you. Women like to explain things away, or we're just too darn busy to stop. We're like, okay, I need to get the kids off to school, right? And so we ignore our own symptoms. So again, you need to follow, the medical word is gestalt, that Jiminy Cricket that sits on your shoulder that says, something just doesn't seem right. And if you're feeling that way, make sure that you're following up with your healthcare professional. Speak to your physician if you don't want to call 911. Talk to them about your symptoms, and then they will give you direction. Either come on in and see me or call 911. These are things that I'm concerned about. Also, I really want to encourage you, please don't be hesitant to call 911. There's many barriers. People are afraid they're going to have to pay for it. They're afraid that if they're not a United States citizen, that they're going to be deported. They're afraid that if they're in an environment where maybe there's drugs or alcohol or something else that was illegal, that they're going to get in trouble. None of those things are going to happen. So you are protected always as the caller, and you don't have to worry about those things happening. We're very concerned about you. We're very concerned about your friends and family, and please use 911.
Excellent. I knew I could put you on the spot with that one. So thank you so much. And that's going to conclude our presentation for today. Thank you both again, Illinois Heart Rescue, for all that you do across the entire state of Illinois, particularly in Cook County. And thank you for training all of us when we were in person. You came out and you guys trained all of the people at Cook County. We're going to continue that once we get back. You know, I know we had a great plan in place, but then COVID happened. But we're going to need it even more next year. So I look forward to doing that again next year when it's Heart Month. And thank you all for joining us today. It's really important that we share this information. And you don't have to be an expert to do CPR. I think you can see, you can practice, you can teach a person, you can get trained. If you want to take it to the next level, if you want to join Illinois Heart Rescue in one of their certified CPR training classes, you can do that. But this type of CPR training will help you save someone's life. And that was what our goal was and intention here today. So Terry and Claire, thank you very much for sharing, again, your expertise with us. Thank you all for joining. And if you have any questions, we'll have more update information in the chat. You can reach out to Illinois Heart Rescue or reach out to my office, and we'll be happy to answer those. Have a great day.
Thank you, everyone.
Thank you.